As a Democrat, we have Sofia and as a Republican, Maria Fernanda, and they are going to be debating if Obamacare should be repealed.
The Obamacare allowed a significant part of the American population to have insurance plan. It is equivalent to 20 million people. To make insurance affordable, Obama made insurance companies no longer able to deny coverage for pre-existing conditions. It demanded business with more than 50 employers to offer them health insurance, receiving tax credits to help with the costs. It provided tax credits for insurance to the middle class and allowed adults to share the same plan with their children until the kid completes 26 years old, lowering costs and increasing safety for the family, who no longer needed to pay for two plans or deprive some of its members from insurance plans. Also, Obamacare made preventive care free. By emphasizing prevention, it cut costs by requiring all insurance plans to cover 10 essential health benefits, and so identifying and treating disease and injuries before they become emergencies. Those include mental health, addiction, chronic disease management, lab tests to diagnose diseases, maternity and newborn care, dental and vision care for children, and others. The focus is on mental health, addiction, and chronic disease, which can be the most expensive to treat, and if left untreated, many end up homeless or in prison, eventually costing more for the government. The objective is to slow the rise of healthcare costs. Even though the cost for healthcare services continue to increase 1.2% for the year of 2016, it increased much less than in 2004, for example, when the price increased 4%. Another important point is the whole time period under Medicare Part D, in which there is a gap in coverage. Medicare and Medicaid are both free insurance plans for those with low income or with some deficiency. Seniors had to pay the full cost of their prescriptions while in the dental home, but under Obamacare, those costs were reduced. So in 2016, they only had to pay 45% of the cost of brand name drugs and 58% for generics. In 2017, these copays were set to be 40% and 51% respectively. According to the Commonwealth Fund, since 2010, 8 million seniors saved over $11.5 billion on prescription drugs due to gradual closing of the dental.
The Affordable Care Act of 2010 is an economic disaster. It has aided those who can apply for subsidies, but those who can't end up paying a much higher cost. According to the annual Milliman Medical Index, the cost for an insurance plan for a family of 4 in 2018 is of $28,000, much more than the average of $20,000 that existed in 2010. This rise in prices is created by the market instability and the risk of something the experts call the death spiral. What this means is that on a basic level, due to the high premium costs, healthy people are leaving the market. Since Obamacare has made it illegal to discriminate based on pre-existing conditions, it is more cost-effective for some to just buy insurance when you really need it, making the companies lose money. This loss is then passed on to the consumers, and the prices gradually go up, which then leads to more people leaving the market, and the cycle just continues. It is estimated by the Congressional Budget Office that over the next 10 years, there will be 26 to 28 million Americans uninsured. Another significant problem is that a lot of businesses, including major insurers, are leaving Obamacare. According to the Kaiser Family Foundation, 32% of American counties have only one insurance provider, and 49 of them have none. With large companies like Anthem, United Healthcare, and Aetna leaving the exchange, this number just tends to go higher. Of course, than a monopoly, the single-acting insurers can charge as much as they want since people will have no other option available. In addition, the expansion of Medicaid and Medicare has been a burden for states. Despite the implementation of the Medicaid tax, a lot of states are suffering with the ACA costs. That's because 24 states that expected 5 million people to apply for subsidies ended up receiving over 11 million signups. There was an estimation of costs, but this number was exceeded by 49%, meaning that the price was almost 50% higher than the states were prepared for. This is also extremely problematical at a federal level. In 2012, the CBO updated their estimated cost of the Obamacare from $940 billion to a staggering $1.76 trillion. In total, ACA subsidies are equivalent to around 3.4% of the U.S. GDP. And according to National Interest, healthcare is the single fastest growing sector of the federal spending, and it could result in trillion-dollar deficits in 7 years' time. It is fairly easy to state that Obamacare has been a way for all taxpayers. Of course, it is important to provide affordable health care and to nurse the American people. However, the Affordable Care Act ended up creating more problems rather than solving them. Governmental intervention in private market rarely works, and letting the market act could be a solution. In conclusion, the Affordable Care Act of 2010 should be repealed so that we can seek a sustainable option that will actually help and meet the needs of the entire American population.
Medicare is the largest source of funding for medical and health-related services for people with low income in the United States, providing free health insurance for 74 million low-income and disabled Americans, 23% of the population, as of 2017. Even though it is imperfect, together with the Medicaid, it has helped more people who would otherwise struggle to obtain any coverage at all. In most cases, Medicare coverage is a more affordable option than what some seniors may find through private insurance.
So both arguments and reviews were excellent, but the